Welcome back. Now, I'm not sure I need to say too much about my next guest. You pretty well know the story. When the pandemic hit, this acclaimed physician, scientist and cardiologist was no fan of experimental COVID vaccines for all demographics. He knew that there were treatments available as well, such as hydroxychloroquine and ivermectin, and he made no friends in the world medical fraternity who all seemed, well, vaccine brainwashed by Big Pharma. Of course, now we know that the brainwashed, well, they got most of it wrong, and this renowned COVID expert has been proved right in so many ways. He's published more than 1,000 articles on a range of medical topics, and he's got 685 citations in the US National Library of Medicine. He is Dr. Peter McCullough, and he comes to us from Dallas, Texas. Peter McCullough, welcome to TNT.
Well, thanks for having me.
Can I start with, well, let's start with the top, with the World Health Organization. You said recently that the WHO failed miserably and were responsible for massive shortcomings. Was it because of ignorance? Was it because of a power trip? Or was there corruption involved in all of this, do you think?
No, corruption. I want to be very clear about this. You know, at the very beginning, when the COVID-19 crisis happened early in 2020, the WHO announced an investigation in Wuhan, an epidemiologic investigation of where did the virus come from. And in the United States, Rear Admiral Brett Giroir, someone who went to the same medical school as I did here in Dallas, he was in the White House task force. He nominated 3 independent scientists to the WHO. The WHO said, no, we don't want these independent scientists. We want Peter Daszak, who we found out later on was leading the EcoHealth Alliance. Peter Daszak was in on the creation of SARS-CoV-2 with Anthony Fauci, as well as Ralph Barrick at UNC Chapel Hill and Dr. Xingling Li, the bat lady in Wuhan. Peter Daszak had been to the lab numerous times. So the WHO from the very beginning knew this was an inside job, and they were corrupt with the WHO investigation. And when Daszak came over there, he said, well, the virus, it could have come from anywhere, but just not the lab. Daszak was lying through his teeth. He knew that they created the virus in the lab. Later on, Daszak was debarred from all government U.S. research. He should undergo criminal prosecution. But that's an example of how the WHO was intentionally deceiving the world from the beginning.
And were they intentionally deceiving the world when their big pharma donors convinced them that experimental vaccines were for all?
It's clear that the WHO took the lead and all the other public health agencies followed. Instead of taking a risk stratified approach, that is vaccines for people who, if the vaccines were safe and effective, who would need them would be nursing home patients, those are very frail in congregate living situations. Yeah. In the United States, we have 330 million Americans. I had calculated that at most it would be 2.7 million that could be eligible for a safe and effective vaccine. This idea that everybody has to take it in terms of babies down to 6 months, everyone knew that was wrong.
Yeah. You've also said that COVID created a bio-pharmaceutical complex and vaccine ideology has become a religion. Vaccines were never meant to treat the flu. How did that happen?
Vaccines have basically, at this point in time, taken over and consumed this biopharmaceutical complex, this syndicate that's formed with some of the entities we talked about, World Health Organization, World Economic Forum, Gates Foundation, Rockefeller Foundation, Wellcome Trust, Gavi, Unitaid, the public health agencies, your TGA in Australia. We can go on and on. You know, and the pharmaceutical companies are suppliers to the complex. But what they've learned, instead of making a treatment that you'd have to use in a smaller number of sick people, it's far more profitable to make a vaccine that everybody has to take. Can you imagine a product that everybody has to buy? No questions asked, that you'd be mandated to get this product?
Rivers of gold, Peter, rivers of gold.
Oh, my Lord, exactly.
All right, let's talk about the dangers of mRNA vaccines. They've had disastrous impacts for the heart, the brain, blood clots, immune system. Paramedics talk about teenagers dying at home of vaccine myocarditis. We were conned, weren't we?
Oh, we were conned beyond belief to think that the vaccines were safe and effective. That mantra came out days after Pfizer's emergency use authorization in December 10th of 2020. American Board of Internal Medicine 5 days later told doctors, take the vaccine, take a picture of yourself taking the vaccine, and then pressure your patients into taking it. How did they know 5 days after the EUA what was going to happen a few months later? No one could have known if they were safe and effective. There was only 1 month of primary series and then 2 months of observation. No one knew by month 3 that people are going to develop blood clots or myocarditis or other problems. And now, our FDA guidance says we got 5 to 15 years of worry after people have taken a genetic vaccine. That would be Pfizer, Moderna, AstraZeneca, or Janssen.
5 to 15 years. And of course, I guess we should have all woken up when governments around the world waived big pharma's legal responsibility for what may happen from the vaccines.
This freedom of liability has been a terrible development. The companies are showing no interest in making safer products, showing no interest in disclosing safety information so we can make our own choices. In fact, the companies have been working to conceal safety concerns with the regulatory agencies, and they don't care if there are problems or not because they're not going to be sued.
And I just want to underline something we got from that New Zealand study where we discovered that the observed side effects were far greater than what was originally expected. That's a very important finding, isn't it?
It is. So it was safety data. What matters is what's observed, not theoretical computations, not relative risks. In safety data, it's the simple, crude numbers. Let me tell you, anybody who dies after taking a shot, 5, 10, 15, no more than 50 deaths any country would ever tolerate. In the United States, within 90 days, we had 1,223 Pfizer deaths, sometimes right in the vaccine center. We've had hundreds, if not now, well over 1,000 deaths that have occurred just immediately on the day people take the shots. That is so far beyond being acceptable. The product should have been pulled off the market very quickly in 2021.
When you were beginning to stand up against this incredible mismanagement of COVID, you must have faced enormous backlash, and we know a little bit about the backlash. How bad did it get?
Well, professionally, it was comprehensive. Essentially, my entire career was dismantled. But it wasn't about me. It was about people, being damaged by these things. People were taking the shots and dying in the vaccine center, developing blood clots, heart damage. This became a horror show. And then before we knew it, people were forced into taking these shots. They were forced into taking the shots to keep their job or go to school.
Yeah.
Now, I can tell you over time, 2 studies, one from Denmark, one from Czechoslovakia, have shown the vaccines have gotten safer. The most dangerous ones were the ones used early on in the pandemic. They have progressively gotten safer. And the other very important point is very few people are taking them. Today on my Twitter feed, we have our world in data. I can tell you in the last year, virtually no one's taken a COVID shot.
Yeah. The booster take-up in nations like the United States and Australia is gross. It's pathetic. You want those boosters withdrawn from sale, but what does the poor take-up say about the knowledge that people have now, do you think?
We have 3 Rasmussen surveys in the United States. Patients know the vaccines are dangerous. The most common reason why people are not taking a COVID vaccine is they know the word on the street. They're causing record injuries, disabilities, and death.
And they've woken up to it. They don't want a booster. And I've spoken to people who were very much part of the brainwashing during COVID who just won't have a bar of it. And in particular, they won't dare allow their children to take it. That was wrong from the get-go, wasn't it?
It was, because the children didn't have a stake in this one. Remember, they didn't get serious COVID. Most of them had already been through the illness. Virtually every person now in America, every other country has actually been through COVID. If we actually measure antibodies, I do this in my clinic. I rarely find somebody who has not truly had COVID. So we're all through it. Second and third infections are characteristically mild. No one should be hospitalized. Even
No.
those are very frail. They can receive McCullough protocol, which is a multi-drug protocol. It's broadly embraced all the reasonable drugs to use in this illness, starting with nasal sprays and gargles, over-the-counter nutraceuticals and supplements, hydroxychloroquine, ivermectin, Paxlovid, molnupiravir. We have no problem using the EUA products when they're reasonable. So the bottom line is, people who were hospitalized or died with COVID, they did so because of a lack of early treatment.
And then we have the Paris Olympics, where some Olympians weren't allowed to race in the race that they've trained for 4 years because they got COVID, probably for the fourth time.
It's true. The more COVID shots someone takes, the more likely they are to get COVID. It backfires. That was shown in a Cleveland Clinic study by Shretha and colleagues. 51,000 Cleveland Clinic workers, huge study. It backfires. It's best not to take any shots and then have natural immunity carry you.
Just back on kids again, I spoke on air recently, earlier this week, about the Oxford University data that they were able to obtain with the approval of NHS England. And these are for children in the UK. And I told my audience this week and reported what some of the findings were, including the fact that the jab sent kids 5 to 15, 1 in 25,000 of them, to hospital with heart problems. But none who were unvaccinated turned up for the same problems. It did more harm than good.
It's true. The Open Safely study showed you don't get myocarditis with the COVID infection. Doesn't happen, but it happens with the COVID-19 vaccine. That's been a false narrative. Do you know the American College of Cardiology still says you get more myocarditis with COVID than the vaccine? It's completely false. Open Safely study, huge study published, shows it's the vaccine that causes heart damage, not COVID.
Well, what's wrong with the American College of Cardiology? After what we have seen in so many studies post-pandemic, they are still recommending COVID jabs.
None of the major organizations have reversed their stance on this. From day one, they said take the jab, and to this day, they still recommend it. Now, the World Council for Health in Bath, the United Kingdom, has advised to pull them all off the market. Association of American Physicians and Surgeons, same recommendations, removed from the market. Florida Surgeon General Joe Ladapo has made the call. I've made the call in the U.S. House, the Senate, British Parliament, Brazilian Chamber Senate, European Parliament. So listen, people have heard all over the world the vaccines are not safe and effective. And you know what? They've listened because no one's taken the vaccine.
Yeah, exactly. This is surely about these elite medical fraternities not wanting to lose face. Is that all this is about?
I think it's also not losing face, not losing money. We learned through the Biden HHS COVID Community Core program, these medical societies took millions of dollars, as did media organizations, sports teams, churches. This was the biggest government bribe in history. And a lot of these organizations that took government money, they don't feel comfortable now turning against the vaccines.
Yeah, you've nailed it. I've got to take a quick break. We'll come back with Dr. Peter McCullough right after this on TNT.news. I've got Dr. Peter McCullough with me right now. Peter, you talk about what you have observed. You've got a clinical practice. What have you observed that can be attributed to COVID vaccines?
Well, I'm in my clinic right now. I just finished a busy day taking care of patients. About 5 to 10% of Americans have been damaged by the COVID-19 vaccines. Now, that may seem like a low number, but it's not. When you multiply that to the entire population, that's a huge number of people who have medical problems with the vaccines. Now, conversely, 90% of people who took a shot are fine. So I don't want to alarm people. If there was no sore arm or serious initial side effects, very unlikely there's going to be a problem. Almost always people have a severe reaction in the arm, fever, chills, and then later on they'll blossom something like heart damage or a blood clot. But what I see on a daily basis is myocarditis, either clinical myocarditis or subclinical. Commonly involves the lining around the heart called the pericardium. I saw a case of that today. Pericarditis. That is readily recognizable. We do cardiology tests and blood tests to confirm it, and then we treat it with a drug called colchicine, as well as McCullough protocol based spike protein detoxification. These are three natural products, nattokinase, bromelain, and curcumin. So people in your part of the world can get this. It's a reasonable detoxification protocol. Other things can be added to it. I routinely see blood clots. I saw a blood clot today, a recurrent vaccine blood clot, some of the largest ones we've ever seen. They don't dissolve well with blood thinners alone. Again, they need the enzymes, nattokinase and bromelain, the oral supplements, plus curcumin in our protocol. We routinely see Guillain-Barré syndrome, forms of neuropathy, paralysis, stroke. We see commonly immunologic problems, forms of rheumatoid arthritis, systemic lupus-like syndromes, various rashes and renal failure.
What a disaster. What a complete and utter disaster.
It is. And I'd say the fifth area of concern that's emerging, it's not proven, but boy, are we worried about it, that's cancer. Could the vaccines cause or accelerate cancer?
Yeah. A lot of the patients, when they come and see you with these conditions, do they automatically link it to the vaccines they had, or do you have to do that for them?
No, most link it to the vaccine, but they're frustrated that they've been gaslit by their doctors. They've gone to other doctors, and the doctors say, nope, it's not due to the vaccine. The patients say, listen, I was fine before I took the shot. I took the shot, and then I've developed this blood clot or this problem. The FDA says the vaccines cause blood clots, but the doctors deny the association.
Just absolutely criminal. What about elderly patients who took the jabs? What does the spike protein do, for instance, to dementia?
Oh, boy, we're really worried about this. Paper from Korea, Rowe and colleagues. The city of Seoul, about 8 million people. They had about half of those recruited into the study and ended up with a good control group of about 39,000 unvaccinated senior citizen Koreans versus about 500,000 vaccinated. And oh my gosh, within about 3 months, no doubt about it, certain seniors do develop dementia due to the vaccine. Everybody listening to this is going to know somebody, and it happens within about 3 months. It's probably cumulative. We think this had an impact on President Joe Biden in the United States, who's on record taking 6 vaccines.
That would not surprise anyone. That would not surprise anyone. Tell me, have people in the fraternity, the medical fraternity, come back to you in more recent times to apologise for their stance and what they may have said about your stance?
I haven't received any apologies, though, but I have a lot of regretful doctors who come in as patients where they've suffered myocarditis, have heart failure, blood clots, or other problems. Sadly, I've seen colleagues die of sudden death, and it looks to me like a vaccine sudden death. But the apologies are not pouring in yet. And the question is, we're 3 or 4 years into this, how long will it take? Well, let me tell you, when it came to hand washing and Ignaz Semmelweis, mid-19th century, it took over 20 years before the apologies came in. Right. If it came down to smoking and lung cancer, Rose and Hill, it took nearly 25 years. And then more recently, the opioid crisis, largely a physician nursing-driven crisis, it's been about 20 years. So I don't expect apologies now, but maybe, another 15 years.
We need to be a little bit more patient. You've had a big win in Louisiana recently with schools banned from accessing vaccine records. And because, as you know, mandates were used so badly and so cruelly, weren't they?
They were. People were desperate. They wanted some protection. That family members want the choice about vaccinating children. There are children who have reactions to vaccines, family history of autism, other problems, great concerns. And finally, Jill Hill, who's the key leader in Louisiana, punched through legislation that said, listen, the schools cannot demand or ask for a child's vaccine record. That's private information. Children need to go to school to learn. The schools need to get out of the vaccine business.
Can you believe that there are still mandates in place around the world?
It's shocking. We still have about 20 U.S. colleges. In Texas, we're a big state. We only had 4 in Texas. All the big schools never mandated it. companies very sheepishly dropped these mandates as their employees were injured with the vaccines. I think we're going to see a wave of legal activity. This is going to be like the big tobacco settlement that comes in later on. The public is just not going to tolerate this year after year as the disabilities and other problems pile up.
I wanted to raise the bird flu. There's now this attempt by the vaccine brainwashed and the Bio-Pharmaceutical complex, which you've named it as, to make this piddling bird flu some kind of next pandemic. It is just a massive beat-up, isn't it?
It's a government-manufactured, contrived crisis. There is no crisis. We've had over 100 years of bird flu around the world. This one's a very mild strain, no large numbers of poultry dying, very mild cases in humans, basically pink eye. Can you believe the U.S. government has emergency use authorized ahead of time bird flu vaccines?
Wow.
The EU has already pre-purchased them. United States invested Moderna to develop messenger RNA bird flu vaccines. The governments are coming on people's farms and doing PCR testing and generating false positives, and then they order the entire flock to be killed. I mean, this is simply a government mania. Yeah. All it's going to do is drive up chicken and egg prices and food prices. It's a complete waste of money and effort. Natural immunity will set in fine for this. The governments ought to save money for where it should be utilized in much more appropriate use of government funds and get out of the bird flu business.
Yeah, and we should get out of the same kind of control system or regime that we employed in the first pandemic if another pandemic comes. I doubt whether many of these governments have learnt their lesson, though, Peter.
I don't think they have, but the people have learned their lesson. I don't know a single person who is going to take a bird flu vaccine. We have data that only 18% of farmers are even letting the government agents come on the land. You know, the governments pay the farmers to do PCR testing, and they pay the farmers to cull the chickens, and the farmers aren't going along with it.
The population of the world is more informed because of your work and your continued work in this area. Thank you so much for what you've done, and thank you so much for maintaining the rage. Appreciate your time today too.
Thank you.
Dr. Peter McCullough.